So today we have a very special guest joining us, Heather Carroll Cox, who is the Chief Digital Health and Analytics Officer for Humana. Humana is one of the leading health insurance companies. They serve 17 million people, including a very large number of Medicare Advantage members. Heather joined Humana about 2 years ago, and interestingly, not from the healthcare sector. She had a terrific career in financial services, including leadership roles at USAA, at Citigroup, at Capital One, before she decided to get into the healthcare industry. During the program, if you have questions for Heather, use the chat function. I will incorporate those into the program as we go. And again, look for an email from Charlene Fan. You'll get that shortly, and that will include the link to the networking program at the conclusion of our discussion. So let's jump right into it. Heather, thank you so much for joining us, for being part of this program today. And while you are clearly looking at the palm trees in the background there, not in the Midwest right now, you grew up on a farm outside of Rockford in Illinois, not too far from Matter in Chicago. And when you were growing up, did you know that you wanted to be a chief analytics officer?
No, I did not know back then, but I'm certainly having a lot of fun with this role at Humana, and I appreciate the invitation to come speak with you today.
Well, we appreciate you being here. So tell us a little bit about your background. You grew up on a farm outside of Rockford, and you ended up in the financial services industry, and now you're part of the leadership of Humana. I think people would be interested. It's an interesting trajectory and kind of what that looked like.
Well, I didn't know me confiding in you that I had grown up on a farm was going to come up today, but I appreciate
no.
it, Karen. No, that's good. I actually, interestingly enough, I grew up on the farm my father grew up on, and my sister is currently at the farm, that same farm, raising her family. So it's been in our family for 3 generations. And yeah, I went to University of Illinois, and really thought I was going to land in Chicago, quite frankly, and that was kind of my dream city. I remember the first time I drove over the hill on Highway 90 and saw the skyline, and I was like 11 years old, and I thought it was the most amazing thing ever, and I knew I couldn't go back to the country. So I knew I had to go to the big city, but did not land in Chicago, but my husband and I have spent the last 26 years. We've been married and raising our 2 daughters in Alexandria, Virginia, right outside of Washington, D.C. And so that's kind of, and I have 4 dogs, but I have a very clean house. I take to make sure that I clean things carefully. If it were normal times, we'd be spending most of our summer heading to Nationals baseball games. That's what we do. And we generally would take our boat to the games, and I'm really missing that right now, especially when they're the World Series champions coming into this year. But all is good. It'll all come back to normal at some point. So that's a little bit about us personally. I spent more than 25 years in financial services and really loved what I was doing, and had the great fortune of really ending up in a change agent role, kind of accidentally or unwillingly, back in about 2008 when I joined Capital One. And I've been on the forefront of really focusing on the convergence of customer experience, the digital experience in particular, along with data and analytics, and how that all intersects to really create new opportunities of engagement for customers. And that started with my days at E-Trade, and I've translated into a larger scale at Capital One, and certainly a global opportunity at Citi. And it's been a great career, and I wish I could say I had planned it all out, but I was an operations geek, but I had to take care of our customers. And when things would go wrong, my customers would start calling, and those were very expensive interactions. And so just focused on how do you help create those digital tools that will really make a difference, a meaningful difference, and create trust. Back when what's called the World Wide Web, it wasn't called digital. So it's a really interesting trajectory over the last several years, and one that I've been super excited to see that it could translate really well into healthcare. It's been hard to learn, though. I'm telling you, it's been 2 years of every day learning something new. This is an interesting industry, but I really am enjoying it.
Interesting industry indeed. So do you think it on balance helps or hurts that you are coming to this role into this industry from a non-traditional healthcare background?
You know, I do think it helps in that there are sometimes that I can ask questions that might be hard to otherwise ask because I'm seen as being in a change agent role, and I can kind of get into the, well, why? And the answer of we've always done it this way doesn't have to apply to my approach and what my team is trying to do. So I think that helps. I also know I can be a bit wearying for my colleagues in that constantly pushing for change gets a little bit old, I'm sure, for anybody who's having to be the recipient and on the other side of that conversation. And so what I've really appreciated about my colleagues at Humana is just the absolute openness to, well, maybe there are different ways we can think these things through. And Humana has been an innovator in healthcare and it's nearly 60 years of existence. So it's not like they don't know how to do this, they do. It's just we're trying to come at it with a very specific set of angles around digital health and analytics and really changing the way we deliver care compared to the conventional of the last several decades.
So you're the first chief digital and analytics officer at Humana.
Yeah.
Why was that role created?
You know, several reasons, but I would offer, I think Bruce Broussard, our CEO, is absolutely committed to ensuring that we improve healthcare delivery in the United States across, you know, more simple and easy and seamless experiences, as well as improved health outcomes for members of our community. And he sees the potential for what digital health can do, not to replace humans, right, but to enhance what humans can help deliver and extend their reach beyond their traditional four walls of their institution, of their practice. And it creates a whole new vector of opportunity for engagement with members to understand their true conditions of life and what's really impacting them. And also getting, you know, to the place where we can hopefully stop health decline. If someone has a chronic condition and it's going to get worse, what can we do to slow progression or prevent progression for as long as possible? And most importantly, because we serve so many seniors in this country, how do we keep seniors in their homes longer and give them the opportunity for healthy opportunities to engage with their family, right? This is about making sure that great grandpa can come to my daughter's wedding. That's what this is all about. It's not about, you know, making sure that people are just getting to see their doctor every year. This is about creating better life outcomes for folks. He's committed to that, and digital health can help. And analytics, driven by analytics, of course, is what the key is.
Yeah, oh, I love that. We chose the name Matter because we found that people in healthcare are just incredibly passionate about doing something that matters. And so that resonates really well with us and our experiences as well. So what do you do? What is the chief digital officer and chief digital and analytics officer? What is your role there?
Yeah, so broadly speaking, to help drive digital transformation at the enterprise level. So that's kind of part one. But more specifically, and what we've really been focused on to advance our strategy here the past almost 2 years, as you said, we've got kind of 4 core platforms that we've been building and enabling within our ecosystem. And I'll walk you through each one if you'd like, and just kind of give some more details to what we're trying to do. But it's all enabled by a move to the cloud. So getting our data and our applications into the public cloud, which is an important part of this journey, but then also driven by what we're calling the longitudinal human record. And so I can talk to you a little bit more about what that really means. But these 4 core platforms, we started with a machine learning platform. So creating real scalability for our data science community. We've created this platform. We launched it in December of 2019. And I'm really proud of the team. I just got the count a little bit ago. We're up to 17,500 reusable features on that machine learning platform, so that data scientists can go in and pick up features and not have to rebuild them all the time. So what does that do? Well, it reduces your time to market dramatically. We were, outside of training the data, spending up to 6 months trying to get models designed and deployed into production. And we're down to 3 weeks in some of these instances, and it's really incredible. We've got daily active users on our machine learning platform is up to almost 150 people, and we plan to continue to scale that. And what we're trying to do there is create this notion of data science made so simple that you can have citizen data scientists. You can have the regular people in the organization who have a passion for analytics and a desire to really dig into data, giving them the capability to do it easily and simply. And so super excited about the potential there. So that's one platform.
Before you go on, when you talk about reuse, there are undoubtedly a mix of people who are watching, some of whom are in analytics professionals and others who aren't. When you talk about reusable features, what is that? What's an example of that? What does that mean?
So a great example and some of the most frequently used features are look-back features. So how many times has this member gone to their PCP in the last 3 months? What is their utilization of this healthcare system more broadly? Like, what's that look back, so we can start to build the prediction of, gosh, if they've been 6 times in the last 3 months, we probably have to create another kind of intervention. And what would that look like? And how do we get that into our clinicians' hands? So I think that's just a great example. And there's also automation features there so that you don't have to, again, rebuild core pieces of a model. You can just kind of plug and play. And we modeled this, we used the Michelangelo machine learning platform approach that Uber used to really build this out. So that was kind of the concept that we put in front of us for the capability build. And so again, super excited about the potential for where this will take us on interventions.
And so it sounds like you've essentially democratized access to tools so that people inside of Humana who didn't go to school for analytics necessarily can start to play around and find solutions to help your members. Is that a fair way of saying it?
You got it. And the next big piece of the platform build that we're driving is that democratization of the data as well. So not only creating tool sets that can allow you to create, it's getting you access to the data. So a big part of our move to the cloud is literally democratizing the data from the data silos that exist across the company. And I say data silos not in a negative way, it's just a natural reality of has grown and built it, acquired and built itself. So we've identified, we have hundreds and thousands of sources of data, and I'm not kidding. We know how many we have, and I won't say it all, but we've identified about 3,500 key data sets that we know we want to get to the cloud sooner than later, internal data sets. We also have external sources of data that we're going to try to be pulling in as well. But we're going to logically structure and organize that data so that you have the right access patterns created to get to it. And we'll have the right, access management controls so that the right people get access to the right data. In addition, we're really going after our data. A real interesting innovation vector for us is around what we're trying to do with our innovation sandbox. And we're creating a synthetic data set of our membership, which is, a near identical match to the data, but you could never, through math, you can't actually mine it and unlock it. And so we've had a couple of tests where we're showing that it shows clinical efficacy back to our original data sets. And so that's going to be the real vector of innovation that we're able to drive with this data democratization is through synthetic data. So that's what we'd call our analytics platform as a service. So we get that data in the lake, get it structured, put advanced tools over the top of it, machine learning platform included, and it'll create new opportunities for all types of analytics beyond data science, just really advancing our advanced analytics strategy. And I hope it'll move us from being a data-driven company, which we are, to an insights-driven company where we're really getting core insights from the data that we're leveraging. So the MLP, machine learning platform, and APAS, analytics platform as a service, are two key vectors of innovation and modernization we're driving.
And is that synthetic data set something that you'll open beyond just the people at Humana, or is that just for the internal use only?
Right now it's internal, but the intent is to open that innovation sandbox so that the idea would be that we can find partners in the health ecosystem. We don't want to build everything. There's so many incredible companies. You work with them every day, these startups that are really creating real new vectors of value. And if we could, via API, connect with companies seamlessly and easily without having to go through a ton of contracting and improve the value you could bring to Humana's members with the use of your services, what an opportunity for all of us. And so, yeah, really excited about what the potential is here. And we're, you know, COVID slowed us down a little bit on that front. We've been really focused on COVID response. We've had to swing resources, but we're getting our focus back and excited to see what that'll bring in the back half of this year.
Really interesting. Okay, so that was, I think, 2, yes.
So then we also last year got into market with our first cloud-based population health platform. And so it has 2 forms that we're bringing that to life with. And it's workflow for our owned clinics. So Humana owns several of our clinics, and our doctors work for us, and they're payer agnostic clinics. And so this is about serving their base of members in those clinics. And so it's workflow with analytics embedded into it so that the primary care physician has a view into the record. So it's also the first instantiation of the longitudinal health record, not the human record, the health record, but it's becoming the human record because we're pulling in social determinants of health now, which is super exciting. But the PCP has their view of that record and what's important to them when they're taking care of the member. And then we have the care team with their view into that record. And we're, by the way, building our members' view into that same record. So it's consumable by a normal human across all those populations equally. So creating their own customized view was really important. It's allowing us to find, you know, really the people who have the biggest gaps in care and who really need help now. How do we elevate them to the top and ensure that they're getting the care that they need, that there's follow-up on the care that they need, and, you know, doing that for their entire panel. So that's part 1. Part 2 of the population health platform is an even bigger, a bigger launch for us, which we launched at the end of January of 2020, was a new tool called this one an analytics tool with some workflow baked in. So it's the same underlying record of the members, how it's structured, but we allow this for our clinics that are in joint ventures with us or in our alliance network. And so for the balance of our providers, the vast majority of our providers, they can access their Humana panel and see not only their care needs, gaps in care, the STARS ratings, what we can do to make sure that we're taking care of that member, but also their financials related to their Humana book. So they understand exactly where they are, literally in any moment, in any day, of any week, of any month, and what they can do to more effectively manage that population. And so we're super excited. I just, month to date, well, in July, there were 55,000 records pulled through the month off of that population health platform. So we're seeing great adoption and use, and we're starting to see it really scale, which is exciting. So that's number 3.
That's number 3. So let me break that up a little bit. So most people who have spent any time in healthcare are familiar with the electronic health record. You mentioned, which is clinical data, and normally that clinical data is kind of separated from the claims data, and those live in different places. And you're talking about a longitudinal health record and a longitudinal human record. Can you just talk a little bit more about kind of the direction you're going and what the implications are?
Yeah, and by the way, no, we feed back data into the EHRs too. We integrate back into EHRs so that the information you have is flowing from and to, so that we're not disconnecting the data. We believe in data interoperability and really focused on making sure that we enable the free flow of data as much as we possibly can in the ecosystem. We believe it's absolutely necessary to reduce friction, reduce costs, and really improve health outcomes. So like that is something you'll hear me I'm almost preachy about it, which is annoying, I'm sure, but I'm really excited about the potential too. But that longitudinal health record is all about you and your care, and so that we can actually predict kind of where we need to take, you know, the next set of interactions with you. If we add that human component to it, it's really more about, we're already seeing, we were one of the first organizations to implement Blue Button 2.0 in various parts of our digital experience. And so things like getting estimates on your drug pricing. If you bring your data in through Blue Button 2.0, we can tell you exactly your medications, how much they're going to cost with Humana, like in that moment, which is a really powerful tool. An example, we're doing the same things during annual enrollment period. We're allowing you to bring in your Blue Button data and populate, pre-populate, and so that we don't have to have you redo all of that information. And we also then can better estimate costs, out-of-pocket costs for your Humana plan choice and all kinds of good things. So you look at Blue Button 2.0, that's external sources of data that you're bringing to us that we otherwise wouldn't get if you didn't consent to it. We also want to bring in third-party sources of data. So pick it, but I'll pick weather as one because it's a simple one that we can all really understand. And, you know, what we would like to be able to do is for our members, you know, we can send you a message. It's October 6th, and in Chicago, this is the start of flu season. You have 3 CVS and Walmart locations near you. How about we go ahead and get you an appointment? And if you consent, we'll send the data over so they have it sitting and available and ready for use. And when they close and they actually give you the shot, they can send us back that data, and we can keep that all in your longitudinal human record, right? So it's personalized and contextualized to you where you live, to a condition you need to treat, and then we're able to use that then to inform the next round, hopefully, of predictive analytics and new experiences in the digital realm.
I think this is fascinating. And did this exist at Humana before you got there, or was this something that you have put into place?
Listen, I think about things. I think about this as like kind of the Uber version of interoperability, right? Really allowing kind of us to stitch data sets and products that are like specific to you with your identification key. This is just the opportunity we all have to really rethink how the data flows. So interoperability, Humana has been a leader since the early 2000s. So this is kind of that next evolution of, yes, but if we're really going to think about this from the terms of the customer back and what's most important and what do we need to do? Oh, by the way, we also need to enable caregivers, right? So people who you said need to help you with your care, how do we better get data into their hands and the appropriate data for them to have so that they can get you the care you need? So these are things where I think we're doing some cool stuff. I think other institutions are doing some cool stuff. We're just really trying to do it with that human-centered design approach, that member-back view of how we get you care differently and better and enhancing your human care.
All right, number 4.
Yes, number 4 is our digital health platform. So really excited to get this kicked off and getting it going. But you think about our population health platform and all that source of data we have there. Well, now we're going to start in bringing in new sources of data to link to your member key. And things like, think about virtual care was really the first set of use cases we went after in 2019, where instead of waiting for claims to come from telehealth providers, our partners out in the ecosystem, we asked them to actually connect via API and send us near real-time encounter data so that we could actually have it in real time, so we can start to understand what's happening in between your PCP visits. If you're visiting a telehealth provider, how do we tie that into the record? So, you know, it's very much a platform approach. We ingest new forms of data, create new data products, and this extension of the population health platform, because that longitudinal record feeding population health is really going to help underlie and be a core part of the infrastructure in the digital health platform too. But now think about beyond telehealth, you got remote monitoring, digital therapeutics, you have digital behavioral health, wellness tools, digital wellness tools, your pharmacy ordering online from an e-commerce perspective. All of these need to have a connected experience, because if we create all these point solutions for you as the member and you can come in and use it, but then it's only one-way data flow and it's not logical to you where you go next, we will have taken some of the complexity that exists in the physical world of healthcare, the way we know it today, and replicate it in digital. So what we have to do is instead logically coordinate these services. I want each of the services to be their own beautiful experience, because again, these are elegant solutions that are being built in the marketplace. I want to connect them for our members and make it logical that if you've been to a telehealth visit, if you need in-home testing for COVID, if you then need a follow-up with your PCP, and oh, they've discovered you're having some loneliness issues, so well, maybe we should connect you with a behavioral health specialist. I want that to be all predictive and logical and tied together and helping our clinicians deliver that care versus you trying to hunt and peck and figure it out for yourself. So that's the next iteration, and it's been accelerated because of COVID, which we're excited about.
Yeah, so I want to come back to COVID and how things have changed as a result of the pandemic. But I just want to ask one thing. Everything that you've mentioned so far, I mean, you're talking about so many different data sets and being able to run predictive models and do, things that, really are novel ways to improve health and help doctors and help members. And it depends on the data being able to kind of sync with each other. And,
yep.
You mentioned interoperability. One of the challenges in healthcare, and I don't know if it's the same in financial services, I don't have any exposure to financial services data, but is the sort of incredible complexity of the data and the differing terminologies between this way of describing it and this way of describing it, and there's 112 ways to say diabetes, and there's just like so many things that get in the way of data being able to be pulled together and used harmoniously to generate the kinds of insights that really underpin everything that the picture that you've painted. How do you get past that?
Yeah, that's such a great question. And this was actually a really great opportunity for us to educate all of our colleagues at Humana. Like, just getting the data to the cloud isn't the answer. You actually have to make it consumable. And one of those big steps is really, to your point, normalizing that data. So, male, female can be 1, 2, 0, 1, MF, male, female. Like, we have to normalize that and get it to a more mature place so that it's equal across all the data sets. Now, you're going to have data living in different, levels of maturity. So you'll have raw data so that you can utilize it for your training on your machine learning platforms. That'll take some normalization, but it's going to be pretty raw in general. And then you're going to have full-on data products that actually have automation built within them that are going to have to be highly normalized. And so there's different levels of maturity, and depending on what we need for that data set or that set of data sets, right? Because it can be 23 data sets to create a data product. We're going to have to be really thoughtful about our use cases, how we go about, the normalizing it's tedious and hard, but we have wonderful clinical informaticists that do incredible work to help us clean this stuff up, and so that we can get the 112 forms of diabetes to 1, and so that we can then have that access pattern that's going to give you the insight you need, right? So back from being data-driven, all those are pieces of data and could be important in and of themselves and from the systems they come from, but now we're going to actually create this one lake for the enterprise where data will be normalized and consumable as products, and you'll be able to hopefully leverage the data to find insights versus just getting information. So that's the goal.
Got it. That sounds like a lot of work.
It takes a long time,
Yeah.
guys. Oh my gosh. So we're 2 years in. We're just starting the load of PHI and PII. So we're now accelerating our loads. We've been doing a lot of our work with a combination of smaller data sets and on-prem, and we built out our Hadoop environment to kind of handle the compute capacity we needed over the last year. And so it's a combination, and now as we're starting to migrate everything to the cloud, this takes a while, and getting the cloud environments ready and secure, right? That's a really important part of this. We've got to ensure the security, and so not many have gone before us in healthcare, if really any at this level. So we are really being thoughtful and diligent in how we get these environments ready and how we're going to protect that data once it's there. And so now that we're ready to go, we're pretty excited about the potential for scale across all of these different variations of the platform I was talking to you about.
Yeah. So let's talk about COVID. Obviously we're in the middle of a pandemic. How has your role and the company's approach to data and analytics changed as a result of the pandemic?
Yeah, it's a great question. Well, what we were fortunate enough is we had laid enough of a foundation kind of coming out of 2019 for the analytics platform that I was talking to you about, that we were able to really turn up, let's call it the volume, on our advanced analytics support and the kind of dashboards that we could create as a result of kind of what we needed in COVID. So all of a sudden, we had a massive use case that really needed to be turbocharged literally overnight. And we had the most modern tools available to allow us to do it. And so it's taken us from, in January, just under 1,000 active users, monthly active users on our Power Platform, leveraging dashboards to run their business, to nearly 9,000 today on a monthly basis, utilizing the platform and tapping into that data and creating the insights and the dashboards to run their business. And helped us to manage the crisis itself, kind of what our response was going to be, what containment was going to look like, how we're thinking about the return post-COVID. So it's really advanced and accelerated our schedule pretty meaningfully. And so, we've been saying never let a good crisis go to waste. We have made sure that we would leverage this crisis to really advance work in this front. So you talk about the data and analytics piece of it, but also from a digital health perspective, we implemented within several days a health bot to help kind of triage symptoms. We then partnered with another company, Buoy, to bring more broader triage to life. And so these AI-driven analytics tools that are digital experiences that help people understand what their situation is far faster and at the time and place that they want, it's been incredible. So the opportunity to show Humana, our business partners, kind of just the value of what digital can help to bring and the response to a crisis has been super helpful.
And have you gotten good uptake on things like those chatbots that you just mentioned, and presumably your telehealth utilization has gone through the roof like everyone else's? And what kind of adoption from members have you seen?
Yeah, no, I love that you asked the question. So we built a specific COVID digital experience, kind of one place to come and get all of your information, and we keep it updated constantly with what's happening in the market, what's happening for Humana members, what can help them find services more carefully, easily. We've had 314,000 unique visitors to that digital experience in the last 3 months, which is a great opportunity. We've had over 30,000 health bot users, and that continues to scale because we've added how to get to testing locations and including ordering tests for you to have at home. We're the first insured to offer in-home testing for COVID, and it's covered, 100% covered. And so it's pretty exciting to see, in particular with our membership, because we have such predominance of seniors, that they are really willing to leverage these digital tools. When you look at telehealth, our visits were, in January, February, which would have been indicative of kind of normal run rate time, 0.32% of our visits with PCPs and specialists were through telehealth. In April, in the height of all of this, we had nearly 1.5 million telehealth visits, and that was closer to the 35% mark of visits. Now, it's dropped back down since, we'll see what happens by the end of July and then into August, given the resurgence. But we are running at about 13 to 15% of our visits right now for the last 2 months are through telehealth. And so we're not seeing it go completely away, which is fantastic. And I think our opportunity is, one, we found that the providers have actually really enjoyed and liked and being forced to utilize it, suddenly found it really simple and easy and a great way to see into people's homes. So some of the feedback we're getting is, I can actually see the environment they live in. I can see that they have 3 cats, and no wonder they're having so much problems with their asthma. They never told me they had cats. I can actually have them walk over to their counter and show me all of their prescriptions, right? You see them in the environment, and they're not all cleaned up. Generally, they'll come to the doctor all cleaned up and ready to go. And you see what their condition is on a daily basis. And so these are really, really important inputs into care, right? And so I think our opportunity is working with CMS and lobbying Congress. And there was just a great call last night hosted by the White House to say telehealth needs to be here to stay and insurers need to pay. We agree. And not because it's a cost-cutting exercise, because we think there's real value in these interactions that go well beyond just the convenience of them, which is bearing out. We also have been allowed, and during COVID, CMS gave us the opportunity to put devices in people's hands. So one of the big challenges we have with our population is they might be willing, but they may not have the device, or they may not have access to data plans. And so getting them cellular access of some sort, getting them a device if needed, and helping teach them how to use those devices is another big opportunity for us. And so we're partnering with an organization called OATS as an example. We made a large, I guess, what would be the word? We funded them and
charitable,
gave them some
I don't know if it's a
charitable contribution from our foundation. Thank you. I'm just getting so excited I can't keep my thoughts straight. But they're an organization that's really focused on teaching seniors how to use technology and how to use it to live a more fulsome life and be more engaged with digital populations of people, and doing virtual exercise classes as examples. And so this is a huge, huge opportunity for us. We're super excited to partner with that organization. And our job needs to be, how do we take that 15% rate or so, keep it there, and then start to build from there. And again, when you're talking about non-acute cases, this is a really great opportunity. You and I were chatting, like, you don't have to get in your car, drive 25 minutes, get out of your car in 90-degree heat, walk through the parking garage, go sit in the doctor's office for 15 to 20 minutes waiting for them. Like, all of that friction is thrown out the window, especially for a non-acute or just a regular check-in on your chronic condition with no major issues. There's so much potential here.
Yeah. And obviously you're the way you're describing it, you're very committed to telehealth and see the benefits to providers and to members. And is that a universal position among the industry, or is this, how out front is Humana on this topic?
Listen, telehealth has been around a lot longer than I have in healthcare, and it just has never really taken off, and lots of barriers to that, including, for our population, in the past, access to devices has been a problem, and willingness to use has been a problem. That's no longer the case. And we just did a big survey, and can certainly talk about that too, about what we're seeing with our seniors. But two, you have the providers who weren't incented, right? And there was reimbursement is all messed up, and you've got structural problems with telehealth, and that you have to be a doctor in the state of where the member lived. It's just this is a lot of infrastructure that we've got to figure out how to simplify in order to make this a real opportunity. But my sense is, reading transcripts from things like earnings calls, everybody's focused on it. I think we just I can tell you we have a core passion around it, because one, we want you to have the ease and convenience of care wherever and however and whenever you need it. And that includes in your home. Pre-COVID, Humana is a large payer, and we are known as a large payer. But we're also one of the larger healthcare providers in the country. And pre-COVID, we had 80,000 nurses a day going into people's homes to give them care. And so I think this digital health revolution, not even evolution anymore, this revolution, is that great way we extend your PCP, your care team, into your home with you and give you access from there. It changes the game, and I think it's just a huge opportunity to keep people safer and healthier.
Those 80,000 nurses, have you redeployed them during the pandemic, or how does that, how are you maintaining the level of connectivity with your members when in this crazy time that we're living in?
Yeah, no, great question. And yes, we've been able to redeploy. In fact, we have nearly 3,000 people on the phones every day right now, actively calling our members to ensure that they're safe and so that they have the support that they need. And as of 3 weeks ago, we reached our 1 millionth member. And so we're talking to people at scale here across this country. And we've also really been able to find out just either people didn't have access to food because they were afraid to go out, or they literally don't have the money to buy their food. And so we've delivered just over 1 million meals at this point to our members as well, which is, again, the great value, again, the silver lining of this COVID crisis is we're getting a chance to build that deeper relationship with our members and to find new and better ways to build trust with them, which is really important, but also to help them take care of themselves. If we weren't reaching out, they're not going to their doctors, right? So this is a big deal for us to make sure that we find ways to get to people. And by the way that we kind of triaged and built the intervention list, it was all with advanced analytics, with our new clinical analytics engine that we've been building, and allowing us to focus on those that are in COVID hotspots plus multiple chronic conditions and hadn't been to the doctor in the last 2 months. They're at the top of the list. We can call people who have just been to the doctor and are, could be at risk for readmit, making sure that we get to them and get them timely intervention as well. And so our advanced analytics drove the strategy. Our human angels, called our nurses, reached out and took care of those members and are really showing the value that we, Humana, can bring to our membership base in a crisis.
Humana has a somewhat unique demographic among large insurers, very heavily Medicare Advantage, very heavily seniors. How has that affected your decisions during this pandemic, and how you've been able to engage with them and the uptake that you've gotten among your members?
Yeah, so here's what I would offer. We very much started as we moved into kind of continuity planning back in January, as early as January, and formalizing it the second week of February and going into full-on response mode come second week of March. The safety of our associates and the safety of our members was the absolute top priority. And how do we make sure, especially our clinicians on the front lines, that they were taken care of and that we gave them the tools they needed, the equipment they needed, the support they needed to ensure that they could serve our members. And so that was, and including our folks in the pharmacy, where we have to get prescriptions out to members every single day, and we can't afford to shut down. And so there were some of our associates who, while many of us could go work from the safety of our homes, many of our associates couldn't. So ensuring that they had everything necessary, including things like extra PTO if they needed to take care of people, special PTO banks that were outside of your normal vacation, that you didn't have to take your normal vacation first. You can access this PTO and do what you needed to do for your personal life, to offering money to support for care for children or elderly parents or others that you're giving care to. So we had a really wholesome, I think, approach, and I'm really proud of the approach we took to support our associates, for sure. You translate that to our members, and it was so powerful to see the way this entire company turned overnight to redeploy people to be actively engaging with our members. So if we couldn't get in their homes, or if they couldn't get to their PCPs, that we know that we could get them to the care that they needed, and that we could have a logical approach to how we went after it, leveraging the advanced analytics tools we've been building. And so, I think you think about the outreach we've had. I told you about the in-home testing. We're the first insurer to offer in-home testing. We just introduced an innovative new collaboration with Walmart and Quest Diagnostics, and so that our members can get more easily tested as well. We're the first healthcare company to offer its member drive-through testing at hundreds of Walmart neighborhood markets across the U.S. And so that's again, just trying to find those new, interesting, innovative ways to help people in the safety of their home or in the safety of their environment in their car to get the care that they need. So it's pretty cool.
Where do you think all of this is going? So in 5 years, in 10 years, if you continue the trajectory that you're on, what does the role of Humana look like in a decade, and what does healthcare from the perspective of one of your members look like that's different than the way it is today?
Yeah, okay. One, I think Humana would be known as an incredible partner in health, in particular for our seniors, but also, members of the military. We support TRICARE, and so half of the military members and veterans in this country are leveraging our healthcare system and network. And so you'd see us as a partner in your health, and that insurance is in the background. It's the way that you finance your care, but you see us as a trusted partner. And to get to that place, we've really got to focus on that combination of appropriate in-person human care, along with the digital reach of that human, along with digital-only tools, and all of that powered by advanced analytics. You can't separate analytics and digital anymore. It's embedded, ingrained, and it's the only way we can get to the place where we're going to have the predictive interventions and opportunities to take care of you that we envision. I think specifically, the role of artificial intelligence is going to play it's going to have massive impact on how we think about care and care delivery, and it's going to redefine healthcare just like it has redefined other industries. I think AI, machine learning, and predictive analytics will be embedded in literally every aspect of health and healthcare. And so, embedded AI will make it easier to make appointments with physicians for either that in-person or virtual visit. It'll be helping us to provide appropriate care at home, finding the health plan that's right for you. Humana or not, by the way, is the way that we need to be thinking about this. Let's find the right healthcare plan for you and for your conditions so that you get the care that you need. And if for some reason that isn't us, then so be it. But we should be willing to have that open, transparent, and honest conversation with you. And how do we help you find a better drug fill and refill experience as well? And so all of those things will have AI, machine learning embedded, and you'll have digital amplifications of the experience and the opportunity to engage with us. And so I think it's really hard to get there. And by the way, artificial intelligence, I want to modify, my team would want me to make sure I say this. It's really about augmented intelligence, right? Making that human smarter, faster with their response, and creating insights that you otherwise couldn't. Your brain just can't operate and move as fast as the compute power available today. So that combination of human and intelligence coming through analytics is going to be, I think, the combo that wins. And so I want to make sure I'm clear on that too. And in no scenario do I see all of this taking over the human interaction. It's going to amplify it, improve it, enhance it, and make it that much easier to get to the care you need in total. And there's an element of our branding that we're bringing to life right now called human care. And it really is, how do you leverage the best of the technology that's out there, apply it in a way that gives real value to your health outcomes and helps your provider and your care team be even more effective. And so you can't take the human out of human care. Otherwise, we're going to have a problem.
I put it in the form of, I know that you have spent a lot of time focused on the customer journey. What does it look like for an individual, a Humana member in the future as a result of all of these analytics? And what is the role of does the role of the provider change in that dynamic and in that interaction?
Well, hopefully it changes in that we are getting better real-time contextual data to your fingertips as a provider. So for that member, N of one, what is it that you need to be looking out for? We can leverage all of the data sources that exist, EHRs included, because that's an important part of this, and overall workflow and ecosystem as well. How do we create the insights that you need to get to the right care interventions right now? And how do we hopefully gather more sources of data over time about you and where you live and how you live and maybe what groceries you buy, and like all kinds of interesting data sets that could really impact and again create that personalized care plan down to the N of one. I have diabetes. My diabetes impacts me differently than it impacts you with diabetes, right? And doctors know that. Technology doesn't necessarily, but technology bringing in incredible volumes of data could actually help that provider tailor that plan for you right here and right now. So that's exciting. I also think a lot more of your upfront care or your simple stuff can be handled through the digital channels. And then we pass that data to the PCP so that their record is always kept up to date. It's not up to you, the member, to take your data, or for the provider to try to go find it in some EHR, and if it might be there, might not be. How do we actually create that ecosystem where you can port your data, you own it, you port it, you can take it with you wherever and however you want, but that same data that's being fed back to us, we're giving to your PCPs and your care teams so that they can actually have that contextualized opportunity to serve you.
And at what point so the healthcare experience for most people today is not a good one. And there's so much clunkiness involved in kind of managing health and going to the doctor. And, there are other services that are, much simpler, and companies have been able to create much more fluid, customer-friendly, experiences, like things like Uber is an example.
Mm-hmm.
Now, that is a much simpler thing to deal with than somebody's health. But I'm interested in your view on, are we ever going to get to a point where the consumer experience of healthcare is sort of fueled by AI and ML and user experience enough so that even though people don't really want to be interacting with the healthcare world, it is a customer-friendly experience in the way that people associate it with kind of, more consumer-friendly companies?
I say if we in healthcare don't get there, somebody's going to do it for us, and it may not be any of the traditional ones we know today. And so this is not an option in my mind. This is an imperative. And given the transformation that's happened in retail and food and transportation, you named Uber, like, what do you think people expect? That healthcare is now more annoying? It's not any more annoying than it used to be, except that you know how good other things can get, and you don't understand why it's not being applied to healthcare. And so I just think, one of the biggest opportunities we have is to figure out how we create this ecosystem of intelligence and logical experience and really beautiful digital experiences that can get you to the human care you need when and how you need it. If we don't figure it out, somebody's going to, and we will be completely disintermediated. And I firmly believe our margins they get thinner and thinner, and they're going to drive to zero pretty quick. To differentiate, it's going to have to be on experience. And if you want a great experience, you have to have absolutely organized data driving intelligent analytics and advanced analytics as well. So we have to be on this journey. This is our path to surviving and thriving, not just surviving, and maybe even getting, totally disintermediated, which would be tragic. And so it's not easy. The data journey, I mean, that could be a whole nother conversation, an hour plus conversation on how hard it is to create that foundation and to get your data out of the silos, get it certified, make sure you have the right governance structure around it to make sure you're updating it on the normal and regular basis, that it stays of high quality, that it's getting accessed appropriately, that data products are getting built so that there's easy access patterns to that data. This is heavy lifting. And again, without the support of, my colleagues and our CEO and quite frankly, the board, this would be really hard to do. It takes time, it takes money, it takes human resources, and it's heavy lifting work, right? It's not sexy, but it's really important.
Are there other barriers? The ones you described, it sounds like with enough resources and just enough people, you can solve those things. Are there policy barriers, cultural barriers, anything else that needs to come down in order to create the kind of future that you're envisioning?
Yeah, I probably way oversimplified it the way I described it. Culture is a big component here. And here's what I appreciate. I appreciate that people across our enterprise are very protective of their data because they want to make sure it's maintained appropriately and not used for, weird purposes, and it maintains the integrity. And that's important. At the same time, I appreciate that, but we also, given the state of the world and where technology is taking this world and the way that data fuels all of those experiences, we can't be protective of it. We need to govern it, and we need to manage it really effectively. And so we've got to change the mindset that it's mine. I'm going to keep it over here. And as long as, you know, and in some cases, extreme cases, it can be, this is my data, and as long as I can protect it, then I don't have to worry about anybody else coming in and doing what I do. I don't see that very often, but I do see people really intent on making sure their data stays safe and secure. We just have to have a trust that the enterprise can help manage that process as well. It doesn't mean, you know, data stewards in the business own the data. We don't own the data. We're enabling it to be accessible, and we're helping you get access to tools that you otherwise wouldn't be able to deploy on your data set alone. So this is absolutely business owning, and we're enabling, and we're creating the opportunity for you to have the environment to advance analytics to a level that, you know, we see companies like Amazon doing every day. It's pretty darn cool.
Yeah. So last question in the 1 minute we have left. For innovators who want to work with Humana, for startups and entrepreneurs, any advice you give them as to how they can most effectively approach and work with your company?
APIs, make sure you got Fire APIs. It's going to be the whole version of the future. API integration into us, not kind of big, long-standing integrations anymore. Let's make data easy to move between ourselves, and that will be the way you can integrate in seamlessly and easily and become a part of our digital health ecosystem, as well as, you know, potentially as we look to open up our synthetic data set, access that synthetic data set to prove that you can bring value to Humana's members.